spirochetes, they belong to order Spirocatales. So this Spirocatales order is divided into two, Spirocataceae and Treponemaceae. So Spirocataceae, they are saprophytes, already we have discussed, and Treponemataceae, they are human pathogens. They cause infections among humans. So we are going to discuss about this Treponemataceae. So this Treponemataceae is having three genera, in that Borrelia, Leptospira and Treponema. So already we have discussed in brief all about Borrelia and Leptospira. Let us discuss about Treponema today. So Treponema, actually these are a very fine spiral slender with a pointed or rounded ends. So they are coxobacilli. So coxobacilli means they are not round, they are not elongated. So they have an intermediate size between cocci and bacilli. So they are pathogenic among human beings. They cause infections. So sexually transmitted disease called as venereal syphilis is caused by one of the organism under this treponema, that is Treponema pallidum. Treponema pallidum is the causative agent of venereal syphilis, sexually transmitted disease it is. So today we are going to discuss in detail about Treponema, the third genera of Treponemataceae, which comes under spirochetes. So Treponema pallidum, so one of the pathogenic organism which causes infections among human beings, comes under spirocatils. It causes venereal syphilis, a causative organism of venereal syphilis, that is a sexually transmitted disease. So Treponema pallidum. So about morphology, let us discuss. This Treponema pallidum is 6 to 8 microns in length and zero point 0.2 microns in diameter with tapering ends. So this the body is coiled in 8 to 15 regular, rigid and sharp spirals. There will be coils around itself. 8 to 15 coils will be there. It is actively motile and it shows some movements and showing a rotation around the long axis. It rotates around its own long axis, and backward and forward movements are seen, and flexion and extension movements are also seen. And it is feebly refractile, and it will not stain with the normal stains, and reproduces a transverse fission. Actually it reproduces by transverse fission. So the long axis divides into two, and those divided parts of a Treponema pallidum, they develop into a daughter Treponema pallidum. There will be transverse fission. There will be cutting at the between. In between, there will be a fission, and they develop into a daughter cells. So the Treponema pallidum reproduces by transverse fission. So transverse fission, and then stain. It will not. It cannot be stained with normal stains, but it stains with a rose red with a Giemsa stain, and with a method Levedita and Fontana methods. So that is of not our scope actually. So Giemsa stain can stain the Treponema pallidum. Stains rose red. It gives a rose red color with Giemsa stain. So next let us discuss about the resistance of Treponema pallidum. This Treponema pallidum is inactivated by drying or by heat. If you dry it by heating, it gets killed at a temperature of 41 to 42 degrees centigrades, and even it will get killed in 1 to 3 days at a room temperature. Means if there is any discharge from the body or pus or something containing Treponema pallidum, if it is there in a room temperature on a floor, it will get killed by its own within 1 to 3 days at room temperature. And if you keep that in at a temperature of 4 degrees centigrade, within 1 hour it will get killed. and it may be stored when frozen at minus 70 degrees centigrade with a 10% glycerol, or in a nitrogen at a temperature of 30 degrees centigrade for 10 to 15 years. It can be stored for 10 to 15 years. So if it is frozen at a temperature of minus 70 degrees centigrade with a 10% glycerol, or in a nitrogen at a temperature of 30 degrees centigrade, you can keep that Treponema pallidum for 10 to 15 years. So that is about resistance. So antigenic structure, if you see, there are three types of antigens. The first type, it is antibody reacts in non-specific serological tests like VDRL, Kahn and Wassermann tests. And the second thing, second type of antibodies, that is protein antigen. So present in a Treponema pallidum. So protein antigen which is present in Treponema pallidum, and it is a non-pathogenic strain, a Rhesus treponema. That is a group antigen. And third type of antibodies, they are the third antigen is perhaps a polysaccharide which is present in the wall of the Treponema pallidum. It will induce the antibodies. So that is about antigenic structure. There are three types of antigens which will induce antibodies among human beings. Next, let us discuss about the pathogenicity of Treponema pallidum. Actually, there are two explanations here. One is congenital syphilis, second one is acquired syphilis. Congenital syphilis means a pregnant woman, if she is suffering from a syphilis, Treponema pallidum will get transferred to the fetus through the placenta. Even in the early stage of pregnancy, 10th week of gestation itself, the Treponema pallidum may get transferred from the placenta. It can cross through the barriers of placenta, and it can cause infections among the developing fetus in the uterus. And some of the infected fetuses, they die, and there will be a miscarriage, there will be a missed abortion, which will result, while others, some of they are they continue the pregnancy, and the fetus will be dead, and if you see, the child will be stillborn. Stillborn means the child will die within the uterus because of infection of Treponema pallidum. And some are born live, but they develop some of the congenital syphilis problems in the childhood. So there will be inflammation of the eyes, keratitis, Huntington's teeth, and saddle nose, periostitis. So there will be many complications related to central nervous system. So if the mother gets a proper treatment during pregnancy for Treponema pallidum infection, the congenital syphilis can be prevented. So that is one explanation in pathogenicity. And second explanation, it is acquired. So this acquired syphilis caused by Treponema pallidum is through the sexual contact. So the person who indulges in a sexual contact with a person who is suffering from syphilis, that is having Treponema pallidum in their body and suffering from the infection of Treponema pallidum, so through the sexual contact, so they will get the infection. The organism Treponema pallidum, it enters through the microabrasions on the skin or mucosal layer of the genitalia. So the incubation period is around 10 to 90 days. So the incubation period means entry of organism into the body and appearance of the first symptom of infection, that is known as incubation period. It may vary from 10 days to 90 days. So this clinical features of Treponema pallidum infection, that is syphilis, may fall into three stages: primary, secondary, tertiary. So primary lesion, it will develop in the first stage, that is, it is very avascular, and it is painless and some circumscribed and indurated superficially, and there will be an ulcer ulcerated lesion will be there. It is hard concrete. It is called as hard concrete. So around the genital organs, there will be a painless avascular circumscribed indurated ulcerated lesion will be there. It is called as hard concrete. They may ask you for 2 marks. So hard concrete. So it is a primary lesion due to Treponema pallidum infection. It is painless, avascular, circumscribed and indurated superficially ulcerated lesion it is. So it is covered by a thick exudate which is very rich in spirochetes. The spirochetes, that is Treponema pallidum, they are very large in number in that thick exudate. So hard concrete is covered by a thick exudate which is having more spirochetes. So the regional lymph nodes around the groin, so the nearby genitalia, the lymph nodes will be swollen. There will be enlargement of lymph nodes in the groin, and there will be a discrete rubbery and non-tender lymph nodes. So lymph nodes, there will be a swelling and they are rubbery and non-tender. There will not be any much pain. So this hard concrete heals up in 10 to 40 days, leaving a thin scar. So it will start healing within 10 to 40 days and it leaves a very thin scar, and then it enters into a secondary lesion. So this secondary lesion of Treponema pallidum infection occurs in 2 to 6 months after primary lesion. So once the primary lesion heals up in 10 to 40 days, so after 2 to 6 months, this secondary lesion will start appearing. So this will appear like a papillar skin rashes and mucus patches in a oropharynx, means at the junction of mouth and the pharynx there will be a papillar skin rashes and mucus patches will be there in oropharynx. So condylomata at a mucocutaneous junction. So this patient will be highly infectious during this second stage because there will be a more number of spirochetes also here, and there may be a eye and meningeal involvement. Eye infection will be there, and meninges, that is the covering of brain and spinal cord inflammation, infection may transfer to meninges and eyes. 25% of the patients who suffer from this Treponema pallidum, they ultimately undergo spontaneous healing in 4 to 5 years of time. So above around 25% of the patients, they undergo spontaneous healing in 4 to 5 years time, and around 25% infections they remain latent, means without any complications and problems, the infection remains latent, and around 50% of cases they enter into tertiary lesions. They develop it after a period of 1 to 33 years. Just see the gap between primary lesion, secondary lesion and tertiary lesion. So this primary lesion, that is called as hard concrete, starts healing up within 10 to 40 days, and secondary lesion appears after 2 to 6 months. So once it gets healed, 25% of the patients they heal up completely, they get cured, and around 25% of the patients they remain asymptomatic, and around 50% of the patients they enter into tertiary lesions. They start getting tertiary lesions after 1 year or 2 year or 3 year, or even after 33 years also they may start getting tertiary syphilis. Tertiary syphilis, that is tertiary lesion you can say. So this tertiary syphilis may consist of cardiovascular lesions. So the Treponema pallidum might have caused lesions in the heart and blood vessels, so consisting of aneurysm and chronic granulomata and meningovascular manifestations. There will be an inflammation of the infection of the meninges covering the brain and spinal cord. So only few spirochetes will be there in this lesions, and it represents a delayed hypersensitivity. So this is about the pathogenicity of Treponema pallidum. Next, let us discuss about the laboratory diagnosis of Treponema pallidum infection. So, if you carry out blood investigations, there will be a leukocytosis. So, that is increased WBC count because of Treponema pallidum infection. There will be a increased WBC count that you can see in a blood investigation, and in an early stage you will see increased polymorphs in a WBCs, and in a chronic cases you can observe lymphocytosis. In early stages polymorphosis, and in later stages, that is chronic stage, you find a lymphocytosis. So that is about hematological investigations. So next let us discuss about the bacteriological investigations for Treponema pallidum infection. In primary stage, you will take a specimen, you will collect it with a high care, because there in a primary stage, as you had discussed earlier, the spirochetes will be in a large number, so there is a chance of infection. So you have to take care, with a high care you should collect a specimen for investigation. So the lesion is cleaned with a gauze soaked in a normal saline, warm normal saline, and you can slowly press at the bottom of the lesion, so you will get a exudate. There will be a discharge from the hard concrete. So you can collect that exudate for investigation purpose, and you can wet films are prepared on a slide. So you can create a wet films on a slide, and you can cover it with the cover slips, and they are examined under a dark ground microscope. You can use a dark ground microscope. They are very useful, and repeated examinations needs to be carried out in case of negative results. Fluorescent antibody test or a smear of exudate gives a more positive rates. And in a secondary stage, dark ground microscopy is also used in secondary stage, and serous exudate from skin eruptions. They are specimen collected from a mucus patches and condylomata, or they are examined in a dark ground microscope. And the same way as we discussed earlier, same way you can observe it under dark microscope. And then serological tests, such as standard test for syphilis. So alcoholic extracts of ox heart tissue, it is used, in which added lecithin. You will add a lecithin to alcoholic extract of ox heart tissue, and cholesterol is also used as an antigen here. So the test employed, they are Wasserman Khan Mineral Disease Research Laboratory. So these are the three tests for Treponema pallidum infection. They are called as standard test for syphilis, STS. Standard test for syphilis. There are three. One is Wasserman reaction, Kahn's test, and VDRL test. VDRL, very commonly used test to diagnose the syphilis, is VDRL test. Venereal Diseases Research Laboratory, that is one of the investigation carried out to diagnose the Treponema pallidum infection, that is syphilis. So let us discuss one by one in detail. Wasserman reaction, one of the tests which is used to diagnose Treponema pallidum. It is a complement fixation test. So here what they do is, patient's serum is inactivated at a degree temperature of 56 degrees centigrade for half an hour. They will heat the patient's serum to destroy the complement present in the patient's serum. It is then incubated with a cardiolipin. Cardiolipin, it is a liquid extract of a beef heart. liquid extract of a beef heart, it is cardiolipin. So what they do, the patient serum they will inactivate at 56 degrees centigrade for half an hour. So they destroy the complement present in the patient serum, and then they incubate that serum with the cardiolipin and guinea pig complement. So what they do, they take patient serum, they inactivate the patient serum at a 56 degrees centigrade for half an hour to destroy the complement, and then they they incubate the patient serum with the cardiolipin and guinea pig complement. So now, sheep erythrocytes and anti-sheep erythrocytes serum is added to a mixture. So they add sheep erythrocytes and anti-sheep erythrocytes to the serum of the patient. They will mix it. If hemolysis occurs, it means complement was not used and antigen antibody reaction does not take place. So it means test is negative and the patient is not suffering from syphilis. So if hemolysis takes place, it means antigen antibody reaction occurs and complement is used up. So it occurs in a positive test. So when the patient is suffering from syphilis, the test will be positive and there will not be any hemolysis, and which means that antigen antibody reaction has taken place and the complement was used up. So that is the positive test, and the patient will be suffering from syphilis. So this test is known as Wassermann reaction. Next test which is used to diagnose Treponema pallidum infection among the patients who are suffering from syphilis is Khan's test. Carefully, they use zero point 0.1 ml of inactivated serum from the patient. It is collected in 3 tubes containing 0.05, 0.025, 0.0125 ml. Freshly prepared antigen will be kept in those 3 tubes. 0.05, 0.025, 0.0125 ml of freshly prepared antigen will be kept in a 3 tubes, and in that they will add a patient's inactivated serum, and they are shaken on a Khan's shaker. There will be a machine called as Khan's shaker, and they will keep it for oscillation, means 280 oscillations per minute. Khan's shaker machine, they will keep that test tubes, 3 test tubes, and they will keep it for a oscillation, that is 280 oscillations per minute. So then they will add a normal saline solution. So then there will be a appearance of floccules. There will be a appearance of floccules. Floccules means there will be a small clots which appear like a woolen cotton. So there will be a appearance of a woolen cotton like, because there will be a clotting, small clots, floccules they are called as. So there will be appearance of a floccules in a positive reaction. So then the test will be positive. If there is no appearance of floccules, the test will be negative. If there is appearance of floccules, the test will be positive. The person is suffering from Treponema pallidum infection and it is syphilis. If there are no floccules, the test is negative and the person is normal. There is no Treponema pallidum infection. So we have discussed about standard test for syphilis, in that Wassermann reaction and Khan's test. Let us discuss about the third test, VDRL test. VDRL, Venereal Diseases Research Laboratory. It is one of the tests very commonly used, widely used, because it is very simple and rapid test. So requires very small quantity of serum, that is 0.05 ml of inactivated serum from the patient. You will keep it in a special slide with a ring. There will be a ring on a slide. So 14 diameter ring will be there on a slide, special slide will be there. On that you will keep 0.05 ml of inactivated serum from the patient, and 1 drop of antigen is added with a syringe delivering 60 drops per ml. So you will use a syringe which delivers 60 drops per 1 ml. So you will drop a 1 drop of antigen you will keep on a that inactivated serum. Slide is rotated at 120 revolutions per minute for 4 minutes, and it is observed in microscope. It is studied in microscope. If you find uniformly distributed needles, it is negative for the VDRL test, non-reactive for Treponema pallidum. If you find clumps, that is reactive serum, it is positive test result. So after that, a reactive serum, further dilution is done to obtain a reactive titer. So it has disadvantages. Actually, VDRL test has some disadvantages because it gives a false positive results for leprosy, malaria, relapsing fever, infectious mononucleosis, hepatitis, tropical eosinophilia, systemic lupus erythematosus, rheumatoid arthritis, bloodless menstruation, vaccination, and pregnancy. So, the positive VDRL test is seen among all these conditions. That is why it is they are all disadvantages. So positive VDRL test, it will go negative within 6 to 24 months. The person who was having a Treponema pallidum infection and he was having a positive result for VDRL, it turns negative within 6 to 24 months. So next is a positive standard test for syphilis, that is Wassermann reaction or VDRL, with a negative Kahn test is always a non-specific. So that is because false positive results are seen with VDRL. So that's why they are the disadvantages. But very widely used it is because it is very simple and rapid test and uses very small quantity of inactivated patient's serum. So that is about bacteriological investigations to diagnose a Treponema pallidum infection among patients who are suffering from syphilis. So next, let us discuss about the treatment of Treponema pallidum infection. That is antibiotics such as penicillin. They use Penidur, benzathine penicillin injection. They use, and chloramphenicol, erythromycin, and tetracyclines. They all are group of antibiotics which can cure the infection of Treponema pallidum infection. So with this, we have completed spirochetes. Spirochetes, in that mainly Treponema pallidum. You need to remember Treponema pallidum. So which causes a venereal disease such as syphilis. So that completes our spirochetes.